Now it's time for our regular health checkup. And as we get in position on the other side of the studio, a new study has found that the HPV vaccine is not only preventing cervical cancer, but it's also helping cut the numbers of deaths from it. UK research published in the medical journal The Lancet shows that women vaccinated in early adolescence have almost zero risk of dying from cervical cancer before the age of 30. Infectious diseases expert and one of our regulars on this program, Dr. Linny Fuong, joins us in the studio. Linny, good morning.
Good morning.
Right, how significant is this new research?
Yeah, so it's really, it is really quite significant. Essentially what it shows is that it's the first time that national data from the UK has shown that a school-based HPV program can actually reduce the risk of cervical cancer deaths in young women. And this is this is a big deal. So the UK have been vaccinating against HPV since 2008, and what they've found is that by vaccinating these young girls and adolescents, that the last 5 years worth of data in terms of mortality shows virtually zero deaths in the age of 20 to 24 from cervical cancer. The other things that it's shown is that there's been at least 200 deaths prevented by this rollout of the HPV vaccine program. And I guess thinking about it locally in Australia, so what we know is that there are roughly 1,000 cases of new cervical cancer reports every year, and there's roughly 250 deaths per year from cervical cancer. So I think this essentially, what this study shows and what the data shows is that if we do great vaccination, so if we have high vaccination uptake and we do great screening, which, you know, we've got a really fantastic program, we would hopefully be able to see the same rates replicated here, where there are no cervical cancer deaths in young women.
Can you take a step back and talk about what HPV is and how it works, why this matters?
Absolutely. So HPV stands for human papillomavirus. It's a virus that's transmitted from person to person by intimate skin-to-skin contact. All people who are sexually active will encounter this virus at some stage in their lives. The key here is that HPV is necessary for cervical cancer. So virtually all cervical cancers in the world are caused by HPV. And so the way that it works is that HPV, generally infections clear on their own, but there are high-risk types of HPV which persist in the body and then lead to cancers such as cancers of the cervix and cancers in the throat and other genital areas as well. So in Australia, we vaccinate against HPV to 12 to 13-year-old girls, so in year 7, and we give a single dose. And essentially, if we keep up vaccination rates, then hopefully, you know, it reduces the risk of cervical cancer in those deaths.
Could we see the elimination of cervical cancer?
Yeah, so the WHO has made essentially has an agenda where they would like to reduce cervical cancer. They'd like to eliminate cervical cancer as a public health risk in the future. So by 2035, they're hoping that cervical cancer does not exist. I think in terms of what we're seeing, you know, the data from the UK essentially shows that if you vaccinate well and you have high uptake rates and screening occurs, that hopefully we can eliminate cervical cancer. In Australia, we have one of the lowest rates of cervical cancer in the world, and we have a great screening program, as I mentioned. There was some really key national data that came out recently which showed 3 key things. The first thing was that by introducing the vaccine, we've reduced 90% of high-risk HPV infections. That's the first thing. Secondly, we've found that, sadly, vaccination rates have dropped. So at the peak of vaccination levels, we had 80% levels of vaccination, 86% levels of vaccination, which has now dropped to about 80%. And then the third thing is, which is really kind of stark, is that 1 in 4 women are actually overdue for cervical cancer screening in Australia. So we need to overcome these barriers because otherwise we will find that there is going to be that increase again in terms of rates. And we know that there are people that are more vulnerable. So in our Indigenous women, unfortunately, there is a higher rate of cervical cancer and they also have a higher rate of mortality. Women in rural and regional areas are also at risk, and those from multicultural backgrounds are also at risk. There is an equity issue here too.
Lindy, when we talk about studies and facts and figures, often they're just numbers. They don't really hit home for a lot of people. But when we look at this study, what are the things that will matter for people whose lives have been affected by this?
Yeah, absolutely. So for women who have been affected in terms of, that abnormal pap smear or have had additional procedures to investigate for cervical cancer or experience cervical cancer themselves, I think this study essentially shows, a lot of hope, because what it says is that, if we do the right thing, if we have high enough vaccine rates and we screen the way that we should, then this will reduce the risk of cervical cancer deaths. The other thing is for parents, I guess, at home, thinking about their year 7 girls, that one single dose of vaccine can potentially eliminate their risk of cervical cancer deaths. So that's really significant. And then I think in terms of sort of the broader Australian population, we need to think about that equity again. So making sure that the vaccine is accessible, that screening programs are accessible, and they're also culturally safe and available to everyone.
Lenny, thank you very much
Thanks,
for your
Lenny.
analysis, as always on a Monday.
Thank you.
Now, Australia's real estate auction clearance rates have fallen below 50%. That's a level not seen since the start of the COVID-19 pandemic. For more, we're joined by Cotality